My name is Craig Lippe. I'm a board-certified orthopedic surgeon with fellowship training in adult reconstruction. I currently work at Southeast Orthopedics in Whiteville, North Carolina with Columbus Regional Healthcare System. Today I'd like to talk to you about the difference between a partial knee replacement versus a full knee replacement. Many patients that come see me in my office when they're considering joint replacement surgery often ask what the difference is between a partial or full knee replacement and whether they're a candidate for a partial knee replacement. So today I'm going to show you a little bit of the difference and who may benefit from a partial knee replacement. When we're replacing the knee, the reason usually is because of osteoarthritis or wear and tear. And that means the cartilage in the knee is damaged. And with a knee replacement, the goal is to replace that worn out bone and cartilage with a metal and plastic prosthesis that gets the bone away from the bone and allows the knee to function normally and without pain. So I'd like to first start off showing you what a knee replacement is. In general, this is what all knee replacements look like. We have a femoral component, or the top of the knee, with a metal piece that covers the entire end of the femur, and then a tibial component that's at the bottom of the knee with a metal component and also a plastic bearing that goes in between. The only thing that's not pictured in this total knee replacement is the kneecap, and that'd be on the front of the knee here, and we usually resurface that with a plastic button. So this will be a full knee replacement. As orthopedic surgeons, we consider the knee made up of 3 different compartments. This is a right knee here. So this would be the outside or lateral. We call this the lateral compartment. This is the inside, which we call the medial compartment. And also what you can't see is where the kneecap is. We call that the patellofemoral compartment. So the knee has 3 compartments. A full knee replacement replaces all 3 of those compartments. And that's a good surgery and a good prosthesis if a patient has arthritis in 2 or more of those compartments. A subset of patients with arthritis just have wear and tear in one part of the knee. And a partial knee replacement will just replace a single compartment of the knee. The most common and most successful is the medial compartment. About only 10% of patients have that pattern of wear. So out of 100 patients, maybe only 10 patients actually have a pattern that would be compatible for a partial knee replacement. But if you are one of those 10%, a partial knee replacement offers some advantages. It's a little bit quicker surgery, there's a smaller incision, we have to cut less bone, and there's usually a little bit quicker recovery in the long term. So this is what a partial knee replacement looks like. So again, this is a right knee, and you can see the lateral compartment we leave alone, the kneecap we would leave alone, and we just replace the worn out medial side. With this device that I use, we actually make cuts similar to a full knee replacement, but you can see it's much smaller, and this plastic piece is actually mobile where it goes back and forth. So it gives a much more natural feel to the knee when you're bending it. But if we hold up the 2 types of knees, you can see the full knee replacement that replaces all 3, and then the partial that just replaces the inside. In order to determine whether you're a candidate for a partial versus full knee replacement, we'd have to see you in the office, get some x-rays, and see which procedure would be right for you.